joining us. We are the Alaska chapter of Hospice and Palliative Care Nursing Association. We're doing a new interview series called We Are Alaska's Nurses, Stories from the Field. And we wanted to highlight the work of all of our hardworking nurses across the state and just share with the community perspectives and experiences of what our workforce is doing in the nursing community in all of our different unique environments. My name is Tracy. I am a nurse practitioner with the Providence Palliative Care team here at the hospital. And I'm also the president of our local HPNA chapter. And I'll hand it over to Janine.
Hi, I'm Janine. I'm an RN with the Palliative Care team at Providence, as well as the secretary and a membership chair for the Alaska chapter of HPNA. And the mission of HPNA is really to provide support for nurses across the state in providing excellent palliative and end-of-life care for patients. And we also, at this time, want to highlight nurses who are working across the state and hear their stories and their successes and their challenges as they provide care during this pandemic. So we want to thank nurse practitioner Paula in Fairbanks, who has agreed to be our first interviewee in this series. And Paula, could you just briefly describe your educational background and credentials and your current practice in Fairbanks?
Yeah, thank you so much. So my background is that I am originally from Montana. So I got my degree through Montana State University. I came up and worked in Palmer for about 3.5 years or so. And I did critical care ER there. And then I moved back down to Montana and I was there for about 5 years doing critical care. In a larger hospital. It's about like Providence, I would say. And so I really loved the science, working in critical care, taking care of open heart patients, taking care of our, EVD and, all the interesting stuff that we can do in the ICU. But I think that the part that made me go back to school to get my master's was seeing our palliative care team work in the ICU, really doing the right thing, asking the hard questions, and really putting the patient and their family first. So that was truly the motivator for me to go back to school. I got my adult gerontological nurse practitioner through the University of Cincinnati. They have a program to promote nurse practitioners in rural locations, so I could continue to work and do clinicals in Montana while still getting the education from that master's degree level. Afterwards, I worked in cardiology. I was the structural heart coordinator, getting patients worked up for TAVRs, MitraClips, minimally invasive heart valve procedures and replacements. And so I did that for 2.5 years. And then this palliative care job came up to my attention in Fairbanks. And I was missing Alaska for sure. And so that was a perfect combination to come back to Alaska and then to really dive into a career that has really been something that I've wanted to do for quite a long time.
Thank you. That is such a long, adventurous road on your nursing career and a lot of different backgrounds, which I find that is really helpful when you are working in palliative care to have such a diverse background. So thanks for sharing that. It sounds like your experience in Montana is kind of what led you a little bit to working in palliative care, but would you mind sharing sort of what motivated you to want to work in this field?
Yeah, I think pairing what I really like about palliative medicine is that it's pairing not only the science and the technology of medicine, which I find super fascinating. It's a constant, changing field, no matter what field you're into. But I think it's a specialty that really puts the patient first. And so that's where I want to take the intricacies of the science aspect of healthcare and really tailor it to each individual. And that just really feels like the right thing. And using our technology, using our tools that we have as healthcare providers to provide relief of suffering. And that's a major thing rather than So in my background of doing heart valves, rather than changing, you know, the outflow and going off of numbers, and that's a successful heart valve replacement. But if the patient is now in a assisted living facility, I think it's pairing those two different pieces, is that having good outcomes, not just by data, but also good outcomes from the patient and their family and what they're able to say.
That's great.
That's great.
How can you tell us a little bit about Fairbanks as, you know, the community, and what are some of the great things about working in Fairbanks, and maybe some of the challenges?
Yeah, there's a lot of both, a lot of great challenges and a lot of great things. I think the challenges mainly is that it is a very rural healthcare area. And so with that, there's not the specialties that we rely on when we're used to working in a larger institution. To just get a nephrologist to pop down and give their input, there's not one, you know? And so that's extremely challenging. It's a relatively resource poor area, but I think that the great thing about Fairbanks is the people, and that's why we go into healthcare, is taking care of the people. So it's just some of the most interesting, fascinating individuals, and just really people with a zest for life is the population that we're serving, and that's really what it's all about.
I would think that with being a palliative care provider in an area where there aren't a lot of specialists becomes so important, because you can be that hub and translate a lot of information for patients and their families when they can't see a specialist directly. Would you say that's true?
Yeah, definitely. And I know I took a lot of those being able to have specialists see patients for granted when I worked in other places. But sometimes a patient will say, I just don't want to go to Anchorage to see a pulmonologist anymore. And so oftentimes our decision-making path for treatment is based on geography. If somebody doesn't want to be flown back to Fairbanks and they just want to stay in Venati, that's a geographical decision that we're making. And then our healthcare treatment plan and our symptom management has to correlate with that. So that's a huge aspect of healthcare that it took me a while to realize that it's really the geography that makes a lot of these decisions, and people wanting to be at home, wanting to stay at home, and you know, getting to Anchorage is a big deal for a lot of people. So
that's really the definition of whole person care.
Mm-hmm.
Mm-hmm.
Yeah.
So just to talk a little bit about what's going on right now, can you tell us how COVID-19 has impacted your practice, or any experiences with your patients or families?
Yeah, what a huge impact, huh? Pandemic. This is like for palliative medicine to shine, I think. And so the main thing is that we very quickly realized the limits of our resources, and I think that's not just as Fairbanks, but like as a healthcare system nationwide and worldwide, and really to identify what are kind of the guardrails that people would want to put on their healthcare. Are they okay going to the ICU? Are they not okay going to the ICU? Then when we had this component of how dangerous some things are for healthcare providers, doing CPR, intubating patients. And if that's not what somebody would want, then that shouldn't be part of the equation, and putting healthcare workers at risk if it's not for truly what a patient feels strongly for. So I actually, on our order care set of patients admitted with COVID-19, they had a palliative medicine consult come in. And so that was to get them on the radar, make sure that I could at least meet them, and then really provide that communication to family members, because that's where a large part of our expertise is in the communication piece. And so since there wasn't any visitors, then I could help navigate that, make sure that we're going through all of our, you know, if they have healthcare directives, do we have them? Kind of what is their understanding of COVID-19, being able to make sure that they're fully informed on the information that's accurate, and then information that's particular to their clinical status and their previous diagnoses, comorbidities, etc. So got real busy, and we'll see what the future holds. But I think if anything, what I appreciate of it, it was long hours and stressful time, but I think it really highlights that when the rubber hits the road, having palliative medicine specialists is not just an accessory to a healthcare system. It's an integral part of it.
That's great. That's great that you're automatically included at that admission. That really helps, like you said, build that relationship. So that's nice to hear.
Yeah.
Paula, this ties in nicely, I think, with the previous question. Do you have any clinical pearls of wisdom to share with other nurses who may be listening to this, who are maybe providing primary palliative care in their area of practice?
Ooh, that's a great question. I could use some pearls myself. I've been here for a year. Dr. Bartling, who was the medical director for palliative medicine and hospice, he moved down to lower 48 for family shortly after I arrived. So I feel like the clinical part is something that I just have a lot of learning to do. And so I appreciate being able to call the on-call prov team and say, hey, help me out on this one. But I think the main thing is just stepping up and being present and then listening. So once you're in the room to listen, I think one of the things that I read was a palliative medicine consultation should be 25% talking and 75% listening. So I guess that's a pearl that I try to keep with me, is 2/3 my mouth should be shut.
That's a lovely pearl. I like that one. It gives you a little math with it too. What advice would you give to a new graduate nurse to promote a long and satisfying nursing career? And I know that may look a little bit different now with COVID, but just what sort of advice would you give to a new grad?
Yeah, that's a great question. So number one, I would say is that it takes about 2 years to truly feel like you're competent in your area. And that is if you go work in the ER or OB or NICU or wherever you're at, that there's so much to learn. And unless you have your hands in the mud and you're doing the work, that just reading off of a textbook, you won't feel confident until you do it, and until you do it multiple times. So if you get to work and you're feeling overwhelmed, we've all been there, and that's okay. And I think the main thing is to make sure that you're asking questions of other people, and that if you're 12 months into your job, and if you're still feeling overwhelmed sometimes, that's okay. That is very normal. And I know that transitioning from one specialty to another, recently here, I feel like I'm a new grad all over. And that's something that I've been telling myself, because I know that I get overwhelmed. I want to be able to do more and see more patients, and I'm just not there yet. It takes time to weather.
Well, we're certainly grateful that you're there in Fairbanks, Paula, and we know you're doing a great job, so thank you so much.
Yeah, for sure.
Thank you for taking the time to chat with us today. We really appreciate it. It was lovely to hear about the palliative specialty in Fairbanks. And also, I think it's great to highlight sort of what that looks like in more of a rural setting compared to Anchorage. It's good for the rest of the state to hear sort of what our nurses are doing hard at work, and what the paths that led you there, because it's helpful to give other nurses some ideas that they might not have thought of. So thank you for all your hard work, Paula, and thank you for joining us today.
You bet. Good to be part of the team.
Okay.